Hello, I'm Dr. Mark Gittleman of Optimal Health Miami, and today we'll be discussing SonoWave therapy. As we get older, no matter how well we take care of ourselves, we're vulnerable to the subtle changes of aging. That can show up in many different ways. As a sexual medicine specialist, my focus is on the changes that affect men's sexual function throughout their lives. Solid scientific studies show that men's erection issues can be present as early as their 30s and 40s, and the prevalence of erection problems increases with each decade, so that your risk of suboptimal erections is the same as your age. That is, 40% of 40-year-olds will begin to have issues, 50% of 50-year-olds, and 60% of 60-year-olds, etc. I'm purposely not using the term erectile dysfunction because what men experience as they get older is not an absolute that their erections are perfect one day and then they have full-fledged erectile dysfunction the next day. It doesn't work like that. In fact, this process is a spectrum and a process that evolves over time. Typically, the process first shows up when the patient can achieve a good erection, but it becomes difficult to maintain the erection throughout the process of sexual relations, making it difficult to satisfy his partner and maybe himself as well. With time, the difficulty in maintaining the erection progresses and frustration ensues. Further progression results in a suboptimal erection in terms of rigidity, sometimes to the point that penetration becomes challenging and eventually impossible. At any stage in this process, the man and his partner can encounter significant frustration. Sometimes they talk about it, sometimes they don't. Once the patient reaches me, it's time for the evaluation, and then to consider a whole host of options. A good erection requires good blood flow and good hormones. If you're one of my patients, I typically evaluate both of these, and if hormone balance is needed, it's one of the first things we will pursue. But we will still need to work on blood flow, which is 80% of the equation when it comes to achieving a good, solid erection. Until recently, we relied on the typical therapies we've had for decades. With the exception of surgery, all of these therapies only provide for a short duration of increased blood flow to the penis, and they're in no way curative. These therapies include medications such as Viagra and Cialis, the use of injections into the penis, or the usage of a vacuum erection device, and/or constriction bands or rings. The newest therapy improves erectile function in a totally different fashion. The therapy is known as low-intensity shockwave therapy. The type of shockwave therapy we have chosen is known as SonoWave, generating the energy with sound waves. This entirely new approach is the first and only therapy to help rejuvenate the penile blood flow by actually creating new blood vessels to carry more blood flow to the penis. This creates better rigidity and longer maintenance of the erection. The treatment also allows for sound wave vibrations to mobilize tiny amounts of plaque in the penile blood vessels to allow better blood flow. The current data utilizing this new technology is very clear that it works. An article in the British Journal of Urology concludes this type of therapy appears to improve erectile function, is safe, and potentially plays an important role in penile rehabilitation in men. Another publication in the journal European Urology provides for an analysis of 14 different medical studies. The researchers found that there was evidence that these men experienced improvements in their ED following the shockwave therapy. In another article, a leading urologist from Johns Hopkins University School of Medicine is quoted in the Urology Times that shockwave therapy has now been subjected to multiple randomized, placebo-controlled, and additional open-label studies in clinics worldwide demonstrating impressive efficacy and safety. Lastly, a recent 5-year study of shockwave therapy published in the journal Sexual Medicine showed a 70% improved erection response at 1 year and 40% improvement 5 years after the treatment. The one thing that's clear in all of the medical studies is that there does not appear to be any downside whatsoever in men receiving these treatments. So, what exactly is this treatment? The SonoWave therapy is used to apply 500 sound waves to approximately 12 areas on the flaccid penile surface. A variety of angles are used so that the entirety of the penis is treated, but nothing is applied inside the penis. All of the approaches are on the outside surface of the penis. A total of 6,000 waves are delivered over the course of 15 to 20 minutes, and this constitutes a session. Sessions are scheduled once or twice weekly, depending on the patient's preference and their travel and work schedule. A series of 10 sessions has given us the optimal results, but some patients will opt for fewer sessions. Most patients tolerate the sessions quite easily, but some may opt for a local anesthetic cream to be self-applied to the penis prior to their treatment. In summary, this new medical regenerative technique certainly provides a safe and effective way to improve penile blood flow and erections. In the last several years, we've had a lot of success with this therapy. SonoWave is certainly an option that might be worthwhile for you to consider as part of your therapy to ultimately improve erection hardness and to improve sexual satisfaction for you and your partner.